a nurse intervene in saving the patient's life. Okay, so if you say you have a competency in vital signs check, run us through the national guideline in managing hypertensive patients, for example, from the first point of checking the vital signs.
Okay, thank you for the questions. Managing a high blood pressure patients. Before my license came out, and after my license, I started working as a registered nurse at Western Specialist Hospital. There I got enough experience to proceed to work here. And I think the experience I gathered there is enough for me to work here.
The experience you gathered is enough. So you want me to start defining what is enough? What is the meaning of enough?
No,
Enough is an English word. Now let's talk medical words, medical terms. What are your clinical competencies?
yeah, I'm able to do a lot of nursing practical as far as it is concerned.
Be specific. Clinical competencies. What can you do?
Okay, let's start from like I check vitals, I do vitalization, wound suturing. First I'll roll it so that it will be easier for me. Sorry,
Why do you start to use the
No, let her finish. Chief, let her finish.
me using the left
Sorry,
side
I
because
said
the
finish.
heart
Let
is
us special finish first before I answer.
sorry. Me checking the cardiac force.
Now pause. I've seen what the patient must sit upright and the hand must be placed on. That's why you have a table or whatever it is. That's why initially I said use this. But even if you're going to use this, what you would have done, you see where this hand is placed like this, because the likelihood of you having a correct reading is slim like this. So positioning in vitals it is in the national guideline for hypertension, management of hypertension. Let us assume now you have checked his blood pressure and the first reading is giving you 145/95. And then as part of your interfacing or communicating with the patient, he's telling you that he has never been hypertensive, he's never had this reading before. What is the next thing you do?
The patient will rest first.
For how many minutes?
For like 5 to 10 minutes.
5 to 10 minutes. And then having rested, the patient now comes. Maybe at this point, he didn't come to see the doctor. You know, it's a hospital. Some people will just walk in, I just want to check my blood pressure for different reasons. Now, if you have checked after 10 minutes or 5 minutes or thereabouts, and you're still getting a reading that is still not consistent. The first one was 145/95, and now you're getting like 170/90. What is the next thing?
That means the patient is actually maybe hypertensive without him being aware.
You can't declare, the national guideline does not allow for you to declare a patient hypertensive at the first 2 visits, or the first visit to the hospital. Remember, first visit, 2 or 3 readings. Yes. Have you paused to ask maybe lifestyle? Maybe the patient is not sleeping well, the patient is stressed. What recommendations will you make? Because all those will make you, whether you'll be like my nurse Olivia, powerful nurse, who is very observant, who is empathic, who is thinking of the next thing to do with the patient.
The types of that
Is to identify this, tell me their uses.
So you're a registered nurse or a midwife.
So you identify the medications here, you tell me their uses, the instrument, their uses, how to preserve them, and how to take care of them. So, and what is used for. So anyone you identify or you pick up, you tell us the contraindications, the indications, the uses, and what we use for. So start with the medications.
Okay, thank you.
You're welcome.
This cefdozine 200 mg it belongs to antibiotics. It's antibiotics, and it's used in treatment of some bacteria. The mode of action is it inhibits the protein synthesis.
working in the theatre, being in charge of the theatre, is it true that we have drug cards in the theatre?
Yes, ma'am.
So what are the essential medications that must be in that drug cart? Remember, I said we have, in that role, we have 3 theatres. Now, what are the essential medications that should be in that drug cart? And run us through the management of those cards.
Okay, the drugs that are inside the drug cart, you have the infusions there. You have the anesthetic drugs.
Mention the names, I'm particularly interested.
Infusions like
Normal saline, dextrose saline, normal saline, dextrose saline, sorry. You have
Take a deep breath. It's not important, Joanna. Take a deep breath in and out. This is an essential question. For each time I audit any theatre, I'm always having issues. I'm not just talking about Meridian. Any theatre in the world you audit, part of the issues, the major component in the checklist is a drug cart. Because you know the theatre, should the theatre be in a ready-to-use state at all times?
yes, ma'am.
In the event where there's an emergency, you know there are certain surgeries that come in as emergency, some are elective. In elective, you have the time to prepare. In emergency, it is likely that as the patient is rushed in, you must be ready. In the event where the surgeon needs one of those medications in the drug cart is not there, the likelihood of you killing the patient inside the theatre is high.
those injections.
So